Hello, I'm Alison Sher. I'm the designated doctor for looked after children here in Leeds. I'm here with Angela Dillon and Becky and Olivia from Bevan Healthcare. I've come to talk to you about unaccompanied asylum seeking children that we are seeing in Leeds. These children are under the age of 18. They're seeking asylum from their home country owing to fear of persecution. We know that the US have become separated from their usual parent or carer, and this is often for reasons such as death of the carer or even separation during the journey, which has been very traumatic. We know that unaccompanied asylum seeking children have substantial health needs and social care needs. They have much higher rates of physical and mental health needs compared to their accompanied peers, or even children that are indigenous population to the children of Leeds in the UK. Since 2015, we've had much higher numbers of unaccompanied asylum seeking children in this country. They've either come from Kent through the national dispersal system or they come directly to Leeds. We know that these children come from Afghanistan, Syria, Eritrea and particularly Sudan. So why do these children leave their homes and their parents to come unaccompanied to the UK? We know that there's a danger of them being murdered or imprisoned. They are facing political persecution, religious persecution. The girls particularly may be facing female genital mutilation. Some of these young people are forced to take part in political activities and also become part of the militia where they are press ganged into joining forces with either government or militia forces. The US themselves have had a really difficult time. They've witnessed civil unrest, war and genocide in their home country. They have been living with the fear of family persecution, trauma and death, but they also have illnesses before they have left their home country which are indigenous to their own populations. Many of them have journeyed to the UK and spent a long time travelling. Some of them have spent time in a refugee camp, and then they come with a journey that's sometimes 2 to 3 years long. During that time they have been imprisoned, they have been tortured, they have been forced into forced labour and beaten if they cannot provide money. They have been treated poorly by smugglers and also the police. They have faced issues of overcrowding and poor sanitation. Some of these young people have also travelled in small boats where they don't have access to life jackets and they can't swim, and this is incredibly distressing for them. So when they arrive in the UK, they often have little or very no English, and some of them have actually had very little or no education. They have to deal with the Home Office and they have to try and navigate their way around getting refugee status. They are often subject to age assessments. This is done by 2 social workers, an experienced social worker who is used to dealing with these young people. It is not done by a paediatrician or expected to be done by any GP. These young people have also had very poor nutrition along the way. They've had very poor access to food, irregular eating, and they've also had a very disturbed sleep pattern. They also struggle to register with a GP. I'm now going to hand over to Becky from Bevan Healthcare, who will tell you what their routine current approach is for registration.
Thank you, Alison. Bevan works across West Yorkshire to provide healthcare for groups who face barriers accessing mainstream healthcare. We provide services to homeless people, sex workers, asylum seekers and travelling communities. Within the asylum seeking population, we help those in hotels and also the UASCs. We provide mandatory new patient health checks for all of our patients. It takes around 30 minutes. This helps us to build relationships between them and the staff and support workers. We invite the support workers to sit in with consent. We understand that other GP practices may not have the time or resources to do this, but we hope that you can take parts of it like the blood test screening and put it into your practice. In these appointments, we look at dental and vision problems, book immunisations, and do some physical and mental health checks. The blood tests we do are for TB and BBVs, and we also do a urine test for gonorrhea and chlamydia. We explain to the patients that this is a routine test and it helps create a non-judgmental space. This helps patients to get screened without having to discuss any sexual health history or past abuse. The BBVs include Hep B, Hep C, HIV and syphilis. I'm going to hand over to Olivia to talk about mental health in the asylum-seeking population.
During the new patient health check, we have a good focus on mental health and signposting to relevant mental health services. This takes around 5 minutes of the appointment, but it's really important to build rapport with the patient. We find it's easier to do this by asking mental health based questions rather than focusing on diagnosis due to the stigmas in some religions and cultures. PTSD is obviously a big part of the child asylum seeker population and the journeys they've made. We're very cautious to bring that up, but in a mediated way, but also to build trust and rapport with the patients. We're also able to refer to some really good services here in Leeds. There's the Solace programme that helps support new asylum seekers and refugees in the country, has really good therapy groups and one-to-one sessions. You're able to refer to that online through the Solace website. Also, child asylum seekers should be directly referred to any psychologist for any needs they have. So looking at the statistics that we have from York Street, Bevan Healthcare, we currently have 37 unaccompanied child asylum seekers and 16.5 had a positive TB test when we did the screening and 5.6 had a positive bloodborne virus screening. So this shows that it's definitely worth doing to support patients and signpost them in the right directions. It's a really key part of what we do in inclusion health, and all GPs should be wary of this, and we're happy to answer any questions if you want to roll out this service in your GP practices. If you feel unable to offer this service in your GP practice, please signpost people and the support workers with the child asylum seekers to York Street Health Practice, where we'll register them, complete this bloodborne virus screening, immunisations, and then they're ready for mainstream healthcare. I'll hand over back to Alison now.
Thank you, Olivia. When the unaccompanied asylum-seeking children come to see us as paediatricians, they are classed as looked after children and placed on a Section 20. It is our statutory responsibility to do an initial health needs assessment, which is a very holistic assessment looking at their mental and physical health needs. As Bevan Healthcare have already explained, they considered access to dental health, their hearing, vision, education and immunisations. The key areas that we look at particularly are looking at communicable diseases, the ones that these young people have when they leave their home country, but also communicable diseases that they have contracted along the way. We are concerned about their nutritional needs, and as far as the women are concerned, female genital mutilation is a significant issue for some of these young girls, but also some of them have been raped or tortured along the way, and we know that they come pregnant. The current situation in Leeds is that there are 1,500 looked after children in Leeds, and of these 135 approximately are unaccompanied asylum seeking. There's a massive increase due to many more arriving in Kent and sent to Leeds via the National Dispersal System. We know that we should be doing our statutory health needs assessments within 20 working days, but we currently have a 6 to 9 month waiting list, so due to many factors which are out of our control, either social care or lack of appointments. But we are very much aware that this is a huge public health issue, that these young people are going to college, being educated and are walking around with TB and with HIV and syphilis. What we're hoping you can do is when the young people register with your practice, that you can start doing their HIV, TB screening so that we can start their immunisations. If you feel that you are unable to do this, please would you refer them to Bevan Healthcare, where they will receive the initial screening and their initial immunisations. The recommendations from the Royal College of Paediatricians and Child Health and the Department of Health are very clearly displayed on the screen. If you could just do the TB screening and the bloodborne virus screening, then we will do everything else. Thank you very much. We would also appreciate any feedback on this presentation through the QR code. Thank you.